I'm Brittany with Birth It Forward, certified birth and bereavement doula, certified yoga instructor, and family photographer.
Hi, I'm Kristen Mason. I'm also with Birth It Forward. I am a certified birth, postpartum, and bereavement doula, a childbirth educator, and a student midwife. And today we are going to be doing a series on induction. Don't forget to like and subscribe so you never miss an episode. And let's get ready to hear from some doulas who know
Okay.
squat.
Let's talk about induction from zero.
Okay, let's talk about it.
Let's
So
go.
what do we mean when we say induction from zero? What does that mean?
So that means your cervix hasn't made any changes. It is not ready for birth. It is at a zero. You might even be at a 0 to 20% effacement, so softened. Baby still way high in the pelvis, not down and engaged at all. We are not ready to have this baby. Honestly, you might be another week or two out.
Yeah, absolutely. And there are reasons to induce at this point. So that's not really the topic that we're covering here. Brittany has an amazing video that she talked about on different questions to ask before you go into an induction, and we're going to link it below. So if you have not watched that, please pause this video, go watch that one as a sort of pre this video, and then come back and join us, because we're talking about births where the conversation has already happened of, do we want to work on preparing this cervix for birth? Do we want to start this induction, even though it's not what we call favorable? Which we have another really awesome video talking about what that means that we will also link below. If you have no idea what we're talking about when we say favorable cervix or bishop score, once again, pause this video, go watch that one, and then come back where we're talking about, we have already decided that this is necessary for X, Y, and Z reasons, and there are absolutely reasons to do this.
Yes, there are definitely reasons. I don't know that I have a video on the medical reasons for induction yet. So
Medical reasons for induction? Okay.
Yeah, so I wrote a note, but
we'll make one of those too. That's kind of the thing, is that there's so many of them.
Yeah, and we don't want to fearmonger either.
Mm-hmm.
It's not about fear.
Yeah. So in this video, things have happened, and it has been decided that this is the best course of action. Now what? Now what do we expect? Now what are our options?
Yes. So you can, knowing that you're going in for an induction, say you're going in for your induction next Friday, knowing that, go back to video 1 and help prepare your body, going slow, do your nipple stimulation, do all of those things. And then when we get to the hospital, what are they going to do? You can either do Cervidil or Cytotec, usually, is what they're going to start with. Now, one of these, Cytotec, is not approved by the FDA as a labor induction method. However, it is highly used and it has been proven to work, but it comes with some risks. Some people just respond better to Cervidil versus Cytotec, and vice versa. I've had clients who are like, no, I need the Cytotec because I didn't respond to Cervidil, or I had an allergic reaction to Cervidil, or whatever reason. So it's nice to have two medications.
Allergies are always something to take into consideration with all of this. Everyone is unique, and our immune systems react to different things different ways.
Absolutely. So, and talk to your doctor about what method they usually use. They are going to be more familiar with one method versus another method. It is going to be their go-to method.
Yeah. So since Cytotec is so common, even though it's not FDA approved, let's talk about what are the different ways that Cytotec can be offered to you, and so what do you kind of expect once you take it?
Yeah. Cytotec is both offered as an oral or as a vaginal application. And the vaginal application is actually going to be like a gel that is put onto the cervix, which it can be removed if you're showing some signs of it giving some irritation, because it can irritate your cervix and make it really tender, to where you don't want anyone to touch you. However, it will leave some residue, so it's not going to be a foolproof removal. It's because it is a gel, it's not going to fully wipe off. and then it's a pill to go orally. And again, if you have any issues with it, it is in your system. It is in your blood system. Cervidil, I thought of a gel as well.
Cervidil is a gel that is applied to a cotton applicator that looks a bit like a tampon. So,
There you go.
for Cervidil, the way that that is going to look is an insertion of what I just call it the tampon, but the applicator that you lay down for 2 hours with this applicator on your cervix. Don't move. So I tell everyone, go pee because you're gonna lay down for 2 hours. Once those 2 hours are up, then you can get up and move around and you'll just have a little tampon string hanging out. Once again, if you have a bad reaction to it, if it's something you change your mind, you're uncomfortable for any reason, you can take it off. Just pull that string and it comes out. But this is not, just like we were talking about, it's not a perfect removal. There is residue. These are the things. So if you have that, then you wait 12 hours and check and see if any progress has been made. The point of both of these medications is to soften your cervix and to work on effacement. Neither of them is going to necessarily shoot you into active labor, but they are to kind of help get you to the point that dilation will be easier. Cytotec itself is going to generally cause some cramping. That is a very common side effect of Cytotec. That some people say, oh, it's causing this cramping. It's probably going to be pushing me more towards actual dilation than Cervidil. But in studies, they actually rank extremely even in effectiveness for most people. So, the discussion between which one to have and which one to use would be one that you'd want to have with your doctor. And for some people, the fact that Cytotec is not FDA approved is a big turnoff for them. Essentially, if you're using it for your induction, you're using it off label for something that it has not been approved for, which is very interesting to me that it's the most, I mean, Cytotec is used much more commonly than Cervidil is. But it's not actually approved for that use.
That's probably because it is cheaper.
It is.
It's the off label.
Mhm.
But something else to consider with both Cervidil and Cytotec is they take time. You know, you're not going to go in and within 4 hours your labor starts. You're
Mhm.
going to have a Cytotec dose every 4 to 8 hours, and you're
Mhm.
going to need 2 to 4 of those doses. With Cervidil, it's like she was saying, like Kristen was saying, it's every 12 hours you get that dose, and you get 2 doses of Cervidil. That could possibly also be why they like Cytotec more than Cervidil. You get more doses within a smaller time frame, and it works faster than Cervidil because
Um,
you're looking at more than 8 hours.
you're getting
4 to 8.
checked more. That doesn't
Yeah, you
necessarily.
get
The studies actually show pretty similar timelines. Um, so really when choosing in between the two, there's a lot of preference involved. With, anecdotal evidence, clients that I've had, people who have Cervidil, generally are getting this inserted at night and then they sleep all night, no cramps, wake up and they have a more favorable cervix generally. People with Cytotec, uh, not the case. I tend to get called in the middle of the night for my Cytotec inductions because they are very uncomfortable and wanting support. It is not recommended to get a epidural at this point. The longer that you're on an epidural, the more likely it is that it is going to go through the placenta and then you'll have a sleepy baby, which we don't like. We like babies to be awake and breathing when they're born. So once we hit like a 12-hour mark on epidural, we start seeing some of that fentanyl actually in the baby system. So we don't want that. So you try to avoid. Also, it can make it harder to put you into labor if you have an epidural this early. So then I find myself generally being called in and I expect it for a Cytotec labor. So I know there's a bias coming out of me right now, and I recognize that. That I have
now.
a preference of Cervidil for my clients personally. because it works just as well, and my clients tend to be more comfortable, and it costs the hospital a little bit more, but okay, most people, their insurance is paying for it anyway.
I was
So,
gonna say it's gonna cost the insurance more than the hospital.
right.
With Cytotech, I have seen a lot of patients, clients go in early morning as the option rather than going in overnight.
Right.
A lot of times when you know the doctor is planning a Cytotech induction, they'll have you go in at 6, 7 a.m. or even 5 a.m.
Mm-hmm.
to get things started with the Cytotech. So that's something else you can be cognizant of. Would you prefer to go in at night, get some sleep, Cervidil, or would you prefer to get up and go in at 5 a.m. right before shift change, maybe get the Cytotech placed at 7 or 8 right after shift change happens, and then your next dose is at 1.
Right.
So
Time-wise, where we're looking at timelines for expectations. So if you are getting induced with this method, would you expect to be giving birth in the same day?
absolutely
Either way.
not.
No.
No. If
Some
you're going
people
from
do.
zero,
If you're
that
going
is
from
true.
zero.
It's a very, very small handful. Don't expect to
Mm-hmm.
be that person. It's like 1%.
If you have a client who tells you, I am 0 dilation, I'm going in for an induction because I failed a non-stress test, for example.
Yeah, I'm 38
How
weeks.
long do you expect it to be before that baby is born? What's your expectation?
I expect to get called in at least and not until the next day. I check in with them, make sure everything's going well. If I need to, we'll go in and say, hi, how you doing? Here's some things that you
Mm-hmm.
can do to help this progress.
Mm-hmm.
But for the most part, I'm not expecting that baby for another 2 days.
Yeah. My expectation generally is closer to 3 to 4. I've
Yeah.
had quite a few inductions that go to day 4. Just setting how much do I pack? How long do I need childcare for my kids that are at home?
Mhm.
Then you're staying for another 2 days generally after you give birth, 3 days if it ends in a cesarean. So if you're going in for an induction from 0, I would have childcare lined out for 6 to 7 days. Just kind of in that planning. Well, what kind of food are you going to be having? How much clothing do you need to bring? Things like that.
Absolutely. That's a very good point. At this point, they shouldn't be giving you PIT.
Why is
You have
that?
no reason to PIT. Your cervix, again, is not ready to take the Pitocin, which is a synthetic oxytocin, which is what
Mm-hmm.
is going to dilate. Your cervix will not be able to dilate if it's still too hard. Remember that talk we had about the lips versus the nose? We want it to dilate and get bigger around, but it can't do that if it's super hard. So
Right.
again, Cytotec and Cervidil are to soften the cervix so that the Pitocin can make it dilate and expand.
Yeah. Yeah. I like to think of a balloon as you're blowing
Mhm.
up the balloon and all that pressure is being added. When you start blowing up a balloon, the end of it, the cervix, is quite long,
Yeah.
right? And then as you apply pressure, as baby gets
Yep.
on that cervix, we start to see shortening of it.
Yep.
And then it would actually start to dilate.
Yes.
It's not perfect in that way. It's not, I have to get 100% effaced or the cervix has to get completely paper thin before it dilates. It does both at the same time. But generally, you're not going to be seeing much dilation, if any, until you're getting closer to 50%
Yeah.
of
And
the
I
cervix being
I
pulled
have
up
seen
into the
clients
uterus.
who their bodies don't start dilating until they're around 80 or 90%. I have
Mhm.
seen that, and it's not uncommon.
At all?
I've also seen clients who start to dilate at what you would consider a 30% effacement.
Mm,
So
that's much
it's
more
just,
rare.
yes, but
Yeah.
it is based on your body and your body's experience and its muscle memory.
Yep. Yeah. Is this your first baby or not?
Yeah, that muscle memory,
Right?
man,
You have some people that
it's
go in
big.
to get these things done and it's their 6th baby and their body's like, oh, I know how to do this. It's eviction time.
Yeah,
And some people, you
they
gotta, you
go,
gotta walk it through each step and the
yeah,
baby comes out kicking and screaming.
absolutely. And that baby comes fast for some of them. But most people we're talking, it's going to be, especially for your first baby, it's going to be some time. So bring something to do during the early labor stages. Keep your mind busy because you're not going to, you're not going to want to walk around a bunch. You're going to be on equipment, but B, they don't want you to walk around a lot. Sorry to say, they just
Generally.
don't.
Yeah.
Yeah, they want you confined in your room. You're not going to be leaving that room. They don't place it and then you get to go walk around. They place it, you stay here, we monitor you, we make sure it's working and that you're safe. So
Oh.
you stay there. You don't get to go home once they place it. Be
Yep.
prepared for that. And
Yep.
be prepared for nothing to do in the hospital. Bring something.
Hospital
Whatever that
television is no fun. It is very boring.
It is awful. Yeah.
Bring your Roku.
If you can. Some
Bring
hospitals,
something. That's as an example. Bring
yeah.
something. Bring a book, your own personal
Yeah.
DVD player, whatever it is, to set it up. And that could be something that you can talk to your provider about in your prenatal and say, what kind of hookups are we looking at here? If you get to do a tour, go check out that TV, see what you can plug into it. Bring
Call the maternity navigator.
cards. Mhm.
Yeah. I have
Pretend
seen
you're going on vacation for a long time and it's going to be raining
Yeah.
the whole time that you're there, right? What do you
Yeah.
want to do inside?
I have literally seen dads bring game systems and hook them up to the TV.
Heck yeah,
So you can do it.
that Nintendo Switch.
Yeah.
Do it. It's
Yeah.
fantastic.
Your game system.
I have nothing against, I am not the biggest screen person, but there are times and places where distraction is the name of the game. Take your
This is
vacation.
it. This
Take
is
it.
it.
Do the fun thing.
So we talked about PIT being appropriate. Can they have a Foley ball this early?
No. No, you can't.
Why is that, Kristen?
Because your cervix is closed. There's nowhere to put it.
You can't get it in.
Right. If there's no room to insert a Foley or a to insert the catheter, to insert the Foley or the Cook. And we'll talk more about exactly what that is in our next video. You really can't have any methods of induction that require insertion into the cervix. So at this point, we're looking at applications on a cervix to get to the point that we can insert something into the cervix.
Yes. So with that note, let's close this video out and start induction from 1 to 3 because we have a few things that you can do or that they can do to you.
It's not you doing it to yourself at this point. Past that.
No.
All right. See you in our next video.